Hello and welcome to another edition of Spotlighting Jonesboro. Today with me I have Angie Smith, who is a clinical nurse specialist at St. Bernard. She's also part of the health literacy team there, and she's here to talk to us about Patient Safety Awareness Week.
That is correct.
So thank you so much for being here.
You're welcome.
What can patients do to improve the communication between patient and healthcare providers?
Well, one thing they can do is a technique we called Ask Me 3, and it really helps promote patient safety. What it is when a patient asks their provider, their nurse, their physician, even their respiratory therapist, whoever's providing care for them, what is my main problem? That's one of the first questions of the Ask Me 3. And what that helps to do is help us to understand that they understand their diagnosis. The second step is, what do I need to do? Or the second question is, what do I need to do? When a patient asks that question to us as healthcare providers, we know that they know the treatment that they need to follow through when they get home. The third question is, why is this important for me to do that? When a patient asks us that question, we know that they understand the context of their illness and that they understand truly why they're here, their diagnosis, what their treatment is, and why it's important for their individual plan of care. That all falls into our health literacy campaign. And health literacy impacts up to 90 million people in the healthcare system every year. It leads to medical errors. It leads to poor understanding of their treatment, of when they need to follow up with their physician, and it can greatly impact the care that they receive.
Why do you think it's so important to improve this communication? I mean, what kind of risk factors do patients face if they don't open that channel of communication and ask those important questions?
Well, talking about patient safety and Patient Safety Awareness Week, we know that when patients don't ask those questions and they don't have a clear understanding of what is taking place in the healthcare environment, that they may not get good follow-up care, they may not take their medications correctly, they may not seek treatment when they need to seek treatment, or they may seek treatment in an ill-advised way, such as looking on the internet at WebMD and getting ill advice. So we want them to participate in their care, and that's really why health literacy ties into patient safety.
And what does health literacy mean, and what is our health literacy here in Northeast Arkansas?
Well, health literacy is the ability to read, to understand, and act on health information. It's not just their educational level. Even people who are highly educated sometimes don't completely understand what we are telling them to do in the hospital. Mm-hmm. We use a certain lingo and language, so it's an emerging healthcare issue. It again affects not only people who have a low educational level, but also it's affected by age, it's affected by their disease process, and it affects a large population, 90 million nationwide. In our area in Northeast Arkansas, it is a huge impact, and we're working in our hospital to combat that by staff education, through training, through education with the physicians, in the community. We have done some campaigns in the community through our Health Expo. Mm-hmm. We did a program called Medication Reconciliation, and that's a big word, but what it means is when you come to the hospital that you have your medicines with you. You know how you take them. For example, the physician may prescribe them or tell you to take them one way, but because of the side effects or how you feel, you may be taking them a different way. It's real important for us to know exactly how you take your medicines. So we are trying to do that outreach through the community through events such as the Expo.
Well, let's talk more specifically about Patient Safety Awareness Week. What is that and when is it?
Well, Patient Safety Awareness Week, it is coming up. It's March 8th through the 14th. Again, we are highlighting it within our facility with the staff. We're trying to do some fun things. We're going to do a video to highlight some of the things that we do that promote patient safety, as well as coming out and talking about things like health literacy.
Well, it sounds like some great information, and I appreciate you coming out and talking to us about it.
Thank you.
And guys, I want to thank you for watching. We'll see you next time here on Channel 24.